Good morning, everyone, and welcome to today's webinar, Comprehensive DBT Program Overview. My name is Annette Johns, and I'm the Associate Director of Policy and Practice with the Newfoundland and Labrador College of Social Workers. I'll be your moderator for this continuing professional education session this morning. The webinar presentation will be approximately 60 to 70 minutes, followed by a question and answer period. Throughout the presentation, I do encourage you to type your questions using the question mark icon to the left of your screen at any time throughout the presentation, and I'll begin asking them at the end of the presentation. So just keep your questions coming there. That would be great. Dialectical behavior therapy is a topic that social workers continue to request continuing professional education on, and I'm pleased that we can offer this webinar today. Before we get things started, I would like to introduce our speakers, who are all registered social workers and employed with Newfoundland and Labrador Health Services, NLHS. Aldina Hillier-Legg is the DBT Regional Coordinator for NLHS Labrador Zone. Dina Strang is the DBT Regional Coordinator for NLHS Eastern Rural Zone. Leslie Madigan is the DBT Regional Coordinator for NLHS Central Zone. Gina Mercer is the DBT Regional Coordinator for NL Health Services Eastern Urban Zone. And Kathy Fudge is the DBT Regional Coordinator for NLHS Western Zone. So we are so fortunate to have each of these DBT Regional Coordinators with us today, and their full bios are available on the webinar platform. I'll say we have the A team here this morning, having 5 of you, so thank you so much for joining us. I'm really looking forward to the presentation, and I'm now going to turn the virtual podium over to our presenters.
Thank you, Annette. Hi, I'm Leslie. So welcome today to our overview of the Provincial Comprehensive Dialectical Behavior Therapy Program. Okay. Forgive me, I'm not tech savvy. There we go. Can everyone see the change in the slide? No. How about now?
Now it's there.
Okay. Okay. So thank you, Annette. You just introduced all of us and our region, so you've done my job, which is wonderful. But we would like to thank Annette for this opportunity in arranging the webinar for us to provide this information to all of you. So just a quick disclaimer, DBT clinicians require intensive training. Our comprehensive DBT program involved many hours of training, consultation, learnings, readings, and supervision. So today's webinar is just an information session only. We recognize everyone can benefit from DBT, the knowledge and the skills, in particular when you're a healthcare professional with clients. However, today's session does not constitute any formal training. It is strictly an information session for you. Okay, so what's the history? How did the province decide to have a comprehensive provincial program? Well, the history of the DBT is that it was developed under the Recommendation 14 of the Towards Recovery Action Plan. As a part of the action plan, we are working towards transforming our provincial mental health and addiction system to one that is person-centered, trauma-informed, and recovery-oriented. The 5 coordinator positions were created in 2020, and they were for each of the regions. And extensive training was then offered and provided to clinicians across the province. Shortly after that, after the training was completed, the coordinators worked on developing the provincial guidelines for the DBT program, and then that assisted in the implementation of the program across all the regions. you may ask, what exactly is DBT? We recognize that anyone here certainly could have training, they could be DBT informed, they could be practicing it. So this is just a little bit of information. DBT was developed by Marshall Linehan, and we have research that's dating back into the 1970s. Okay? So Linehan developed DBT to treat individuals who experience suicidal ideation and behaviors, and for individuals that meet the criteria for borderline personality disorder. Since the development, DBT has been adapted to treat individuals with a variety of concerns, including eating disorders, post traumatic stress, anxiety, as well. It has been adapted to use with children and adolescents, as well as individuals with neurodivergent disorders. We recognize that DBT is now a widely accepted treatment for severe and persistent emotional and behavioral difficulties, as well as those who experience relationship issues. It is really important to understand that DBT is not a suicide prevention program. Oftentimes, when we have referrals, people think that that is what DBT is there for. Rather, DBT is a life enhancement program. Okay? So, through dialectical behavior therapy, we help teach awareness and skills for individuals to help regulate their emotions, to help them deal with stressful situations and improve their relationships. And in turn, learning all of this helps individuals create their life worth living. Well, how and when can DBT help? Well, DBT is primarily designed for clients with a high degree or a high number of incidents of suicidality and self harm. Four areas in which we see DBT helping people is when you have some confusion about yourself. So, maybe not understanding your emotions or being able to identify your emotions, not always understanding why you are feeling a certain way. It definitely helps reduce impulsivity. So there are skills specifically to actually stop and think about what you're about to do and think it through. It certainly helps with the emotional instability. So, for any of you who have clients or individuals that experience those intense mood changes, it sort of appears like those mood changes are happening for no reason whatsoever. Um, the DBT teaches the emotional regulation skills to help with that. And finally, the interpersonal challenges. So in DBT, we talk about interpersonal effectiveness, and this can help determine patterns that you develop in terms of having conflicts in relationships, the patterns that get you into those conflicts. And it also helps individuals ask what they ask what they need and what they want and get what they need and what they want while still maintaining self-respect. Hey, biosocial theory. Excuse me for a second. The biosocial theory is something that is discussed quite frequently in DBT. So, Linehan's biosocial model believes that an individual's behavior or functioning and the environment that they live in continuously influence each other. I'm sure all of you have probably heard of nature versus nurture, but in the biosocial theory, it's more like nature and nurture. So both things completely influence one another throughout your life. Okay. So under this model, we very early teach individuals in the DBT program that things such as your emotional dysregulation stems from the biological predisposition, temperament, and the individual's interaction with their environment and how they both influence one another. Okay. So the dialectics in DBT, what does it mean? Okay. So thinking dialectically means to look at both perspectives in a situation and work towards synthesizing the possibly opposing perspectives. Okay. So it means that two things can be completely opposite and true at the same time. When we see, I guess, like conflicts between two opposing situations, that creates a tension within that situation that helps promote the changes or helps promote the necessary changes. The quote here is a prime example of a dialect. I am doing the best that I can, and I need to do better, try harder, and be motivated to change. So bottom line, I am doing better or I am doing my best, I'm sorry, and needing to try better are two opposing views, but they are both completely true at the same time. So here are some hints for practicing and adopting a dialectical worldview. Okay. So if we're adopting a dialectical worldview, that means a few things. So we're looking at the perspective from both situations. So almost looking at a situation from someone else's eyes, right? Um, it is so that you can understand your perspective and the other person's perspective, although you may not agree with them, which is fine. We talk about that kernel of truth or the nugget of wisdom within what a client is doing and saying. And really important is the ability to accept that different opinions can be valid even though you don't agree with them. So it's using a both and ways of thinking instead of either or. And if in adapting that dialectical worldview, it means that we're not using the words or words such as never or always, or things like you made me, such as the projecting blame onto other people. Because, of course, in DBT, it is also about being accountable and accepting your accountability. Okay. One quote that, sorry, it's not a quote, but it's just a statement in terms of showing what it means to think dialectically, is I can see your point of view, even though I do not agree with it. Okay, so you're understanding someone's perspective, but you're still maintaining your own thought process. So this last image I have, I think, are two excellent images that really show the dialectic worldview, right? So both of those images certainly show that they're both accurate, even though they show different things. So when I look at the two individuals there, right, it's a 6 and a 9, and they're both completely right. It just depends on the perspective that you are viewing it from. And this black and white image, which I'm sure I've seen in some type of social work or psychology book, for some individuals, they see two faces. Some see a candlestick and some see both. So I just really like how this image is a very clear picture of what thinking dialectically means. So I am now going to pass this over to Kathy, and she is going to continue.
Thank you, Leslie. So I'm now going to discuss the components of a comprehensive program and what does it mean to have a comprehensive program and how do we move towards deciding if the client wants this program, is willing to commit to the program, and actually meets the criteria. So one of the important parts of our program is the pre-treatment phase of the comprehensive DBT program. So the first thing we do before someone joins the comprehensive program is pre-treatment. It typically consists of 4 sessions, and these are completed by trained DBT therapists. The pre-treatment stage in the DBT comprehensive program is crucial and it's critical, where the therapist and clients together determine whether DBT will be an effective treatment. During this period, we typically spans up to 4 sessions, and the client learns about the program, explores what DBT entails, and there's key aspects that we ensure that we complete in this process. So it's a really good place to provide program orientation, understanding of what is DBT, what does it involve, what are the principles, what are the techniques, and what are the goals. The orientation helps the client make an informed commitment to the treatment. We also provide some assessment, and it's completed by the therapist to evaluate whether DBT aligns with the client's needs and challenges, ensuring that the client is aware of the commitments of the program, which you'll hear the word commitment a lot through our presentation. This is critical to the process to secure the awareness of what the program is, and are they willing to commit to what it is that the program is giving to them as well. So we don't necessarily expect lots of enthusiasm, but we do expect a willingness to engage in the process, and that is essential. So during pre-treatment, the client remains with their current therapist, and this is not, as they're not yet considered a client of the comprehensive program. And so at any given point, a client of the comprehensive program can also be a client of another clinician. So in DBT, there are 4 main components of a comprehensive DBT program, and they are as follows. There's a 24-week skills group, there's individual coaching calls, there's consultation team, and there's also individual sessions. So we're going to go into more detail about each of these items further into the presentation, but here's a good introduction of how DBT has many moving parts, and these are all essential, and the program is meant to operate continuously with no stoppage of service. This means that even during summer months, the program is operational for clients, and this is the best practice and in line with the fidelity of the program. So there's continuous uptake in this program during different points. So the first component of our program is the 24-week skills group. So once pre-treatment is complete and the client and the therapist enter into the agreement that this is what they want, then they can then enter into the program. And they typically start the 24-week skills group. So this DBT skills group covers a comprehensive set of skills to help participants improve their emotional well-being and enhance their relationships. The focus of group is enhancing clients' capabilities by teaching them behavioral skills. It is not a process group, and that's really important because it's meant to teach the skills and not necessarily talk about some of the client's history of different things that may have happened in their life. The group meets between 2 and 2.5 hours per week, and the size can range anywhere from 3 to 10 people. And at times, it can be very challenging sometimes to maintain the structure of the group. But it is best practice that we do maintain the structure. And we have leaders and co-leaders, and each of the co-leader and leader have particular roles where they both monitor the group activities and support each other to continue to ensure that the group approach is adhered. So it can be challenging at times to maintain the structure of the group. However, this structure is imperative to ensure the client's safety and teaching of the skills. Clients are encouraged to use words like target behavior language when discussing their issues instead of words to describe their behavior around alcohol, drug use, suicidal behavior, or specifics of their personal behaviors. And that's meant to not have the behaviors to be contagious in groups. So we specifically want that to to happen in group, and we remind clients, if they do use those words, to use target behaviors. Groups meet for 2 hours, and in a 24-week period, the group leader teaches mindfulness, distress tolerance skills, interpersonal effectiveness, and emotion regulation, as well as dialectics. So clients have an opportunity to either come through 6 months, or some clients choose to and are assessed to meet the criteria and enter into the program a second time for a 1-year period. So here's a typical cycle of our DBT skills group. The entry into the program can happen during any mindfulness module, as well as the first week of one of our interpersonal effectiveness modules, or the distress tolerance, or the emotion regulation. So it's continuous uptake in our DBT skills group. So at points it's an open group, and then at other points it's a closed group, depending on where we were in the cycle. There's also individual DBT sessions. They are typically 60 minutes in length. Individual sessions in the comprehensive program are also structured, and there's an expectation to adhere to a session agenda. That's a critical phase and a critical point in our sessions. Every participant in the program must complete diary cards and bring them to the session. And sessions do not start until the diary card is completed. So at times we will allow the client to do the card at the beginning of the session. The diary card is critical. It sets the stage for the agenda of our session. And we're helping clients to discover patterns of behavior, to learn how the patterns persist and ways to break the patterns by using new skills. Diary cards help us to recognize the urge to engage in target behavior, high and low emotions that may occur daily, and behaviors that occur that may be problematic for the individuals. So if they engaged in the target behaviors, such as cutting, we would complete specific tools like a chain analysis to assess areas like the prompting events. So, what happened in that situation? What were the vulnerability factors? Were you tired? Were you hungry? What emotions were they noticing? What thoughts were happening? What were they noticing in their bodies? And help them to come up with a solution by plugging in new skills. And all these factors may be happening at once, but the client, this may be new learning for them. So we want them to be aware of all these moving parts, and out of that, discover what their patterns of behavior are. Also, this session may include things like problem solving, troubleshooting. We may do role plays with the client to help them practice skills in the session and sum it all up so that they can basically move on with their week. So DBT is not talk therapy, meaning that the session is structured, patterns of behaviors are discovered, and new skills are learned to replace the old patterns. Clients become aware of how their own patterns impact their relationships and themselves and others. So not only are they trying to figure out, how is this affecting how I show up with others? How does this affect my relationship with myself? And for some clients, that's really empowering and enlightening. And they have the opportunity then to make some changes to help them have goals of having their life worth living. That's a really important part of our session. So also a part of one of the main components of the comprehensive program is phone coaching. So what does that mean? So essentially phone coaching is during our office hours, and it's another component of helping the client to be able to focus on how to effectively cope with behaviors that are happening for them in the moment. So if they're struggling with applying a particular skill to something that's happening in the moment, they're encouraged to call one of our DBT clinicians so that we can help them discover what's happening and to apply the skill in the moment prior to a target behavior happening. So they can call in between their sessions. In the event that they've engaged in self-harm behavior, they must wait 24 hours before contacting their primary therapist for an on-schedule call, as we don't want to reinforce the behavior, the suicidal behavior. So again, the idea is to encourage the client to call their therapist before they engage in self-harm behavior so that they can try their new skills on in the moment. And after-hour support would typically be provincial programs that are available. Another critical aspect of our comprehensive DBT is a consultation team. So the teams meet weekly, and it ensures that clients are receiving high quality care that is adherent to the DBT standards and protocols. It is considered to be therapy for the therapist, and it helps the DBT clinicians stay motivated, feel confident, and helps to prevent burnout. The intensity of the behavior at times can be challenging to navigate, and the therapist will need to support and continue to provide this high level of service for their client. So consultation team, again, in true DBT style, is also based on a set agenda, and their therapists bring their clients and what's happening to the consultation team, and the other therapists help them stay in line with adherence to the protocols and guidelines of DBT. The therapist must have at least one client, teach skills group, or do both in order to be part of the consultation team. So this is a critical component, and DBT, all these parts have to be in place to be considered a comprehensive DBT program. So there could be DBT informed programs, but for provincially, we have all these parts in the regions to make us a comprehensive team. And consultation typically meets once a week for an hour and a half to 2 hours, and we value that component. So there are 4 DBT skills modules. I will briefly introduce them as other presenters will discuss this in more detail. So as you could see by our previous slide, and all the moving parts of how our group builds upon each other. So there's a component of mindfulness skills. That's a core skill and is repeated throughout the program, as you'll see a little later on. Mindfulness skills are about learning to focus and to bring awareness to the now. There's a full module of distress tolerance skills. So these are skills to help an individual get through a crisis, help them learn to tolerate high intense emotion, and learn ways in the moment to increase the intensity. So they are getting through the moment skills without making things worse. There's a section on emotion regulation skills, helps with understanding, regulating, and de-escalating emotions. And there's also a whole section on interpersonal effectiveness skills. So communication skills, which help to improve relationships with self and others and understand what they want in relationships. And perhaps it might mean amending a relationship, but it also could potentially mean ending a relationship. So clients learn these skills and they practice them back into their environment. So that concludes my portion, and I will now pass it over to Aldina.
Thank you, Kathy. So the first skill we're going to teach is our core mindfulness skill. So the next few slides will provide some brief information on this skill. Of course, mindfulness means paying attention in a particular way, on purpose, in the present moment, and with non-judgment. All mindfulness practice should include focus, awareness, and living fully in the present moment. It's really about learning to control your mind without letting it control you. It involves the process of observing, describing, and participating in reality, and doing so in a non-judgmental way. And also creating an awareness of our thoughts, feelings, and behaviors. Mindfulness is the pause, an active pause before an action. Mindfulness is a skill that we practice over and over. And of course, the more we practice, the more effective the skill is. We want to build our mindfulness muscle. Again, I don't think there's anyone here who would pick up a weight and the first day that you start lifting weights, expect to have strong muscles. The more we lift the weight, the more we practice, the stronger the muscle becomes. So our goal of mindfulness is not to decrease our emotions. It's not to relax. The goal is to achieve a focused awareness living in the present moment. Mindfulness helps create an awareness of our thoughts, feelings, and actions without getting pulled into them. And when we get pulled into our thoughts and emotions, we often spiral. And those thoughts and emotions intensify, and then we are more likely to fall into impulsive behaviors. So our core mindfulness skills include our states of mind, our what skills, and our how skills. And we're going to look at those briefly now. So first, we're going to look at our 3 states of mind. So reasonable mind, that is the mind that is ruled by thinking, facts, and logic. And we consider this our cool mind. An example of someone in reasonable mind would be Sheldon on Big Bang Theory. Emotion mind, over here on the right, is ruled by emotions. We have anxiety, fear, anger, stress, sadness. All of those emotions would live in emotion mind. And we often consider this mind the hot mind. And often when we are in emotion mind, we do fall into impulsive behaviors. And of course, in the middle, we have our wise mind. Wise mind includes both reason and emotion. It is the wisdom within each person and the state of mind we want to access to avoid acting impulsively. And of course, when you need to make an important decision. So it's that place where we can feel and we can access our wise mind and know how to move forward. So we might ask a client, what is wise mind telling you? And of course, in our comprehensive DBT program, we do teach ways and have exercises for each individual to reach wise mind. So moving into our what skills, these skills are skills that we practice one at a time. So the first skill is observe. This is simply wordless watching, just noticing the experience in the present moment without the inner monologue. We can observe what is outside of ourselves. Feeling overwhelmed, we can bring ourselves present by observing the space that we are in. Or we can pick an object and we can observe with our senses what you see, hear, smell, taste, and touch. When we observe something, we are just noticing it. And noticing that it is what it is, and we're not trying to change it. Observing can be hard because naturally our minds want to categorize. The next skill that is part of our what skills is describe. So this is putting words to the experience. Label what you observe with words. So my face feels hot, my heart is racing, I'm having the thought that, or I'm having an urge to. Notice that there are no interpretations here. We are simply stating what you notice. And the third part of our what skills is participate. And this is entering wholly into your experience, just being and being involved in what you are doing. It's kind of getting yourself in the zone, throwing yourself into the present moment fully, whether you're dancing, whether you're cleaning, whether you're outside walking, cooking supper, driving. Fully experience the moment without being self-conscious or getting stuck in thoughts. And an example of how we can use our mindfulness what skills, if something happens at work that is upsetting, and on the drive home, you're stuck in your head with all the thoughts and emotions around what happened that day. If we plug in our observe skill, we're going to notice my heart is racing, my thoughts are racing. Then let's move to describe. My heart is racing, thoughts are racing, and we can participate and use our senses to feel the steering wheel, feel the heated seats, see the trees, the cars, listen to perhaps the music on the radio. Perhaps you have an air freshener in your vehicle that you can smell. You are bringing yourself present and entering fully into the experience. And of course, when we do use our observe, describe, and participate skills, the result is a decrease in emotions. The next skill that we're going to look at in mindfulness is our how skills. And these are skills that we practice all at the same time. So our what skills, we practice those individually, one at a time. Our how skills, we practice at the same time. So the first one there is non-judgmentally. This is where we describe the observable facts. We noticed, but don't evaluate something as good or bad, right or wrong. And if we fall into judging, we don't want to judge the judging. We want to see and not evaluate. We want to accept the moment as is. We don't want to fall into interpretations, assumptions, or judgments. The next one there is one mindfully. So this is focusing your attention on only this one moment, one thing at a time. Staying focused so the past and future and current distractions don't get in the way. And being completely present to this one moment, doing one thing, letting go of distractions. And the last part of our how skills are effectively. And of course, this is acting in your own best interests and doing what works. We don't want to get sidetracked by the principle of the thing or doing what's fair or what's right. We want to focus on what works and what is effective in the moment and act as skillfully as you can without getting sidetracked. So we are going at the beginning of every skills group that we do. We start off with a mindfulness practice as part of the structure of our group, as Kathy mentioned earlier. So we're going to do a little mindfulness practice here today. And what I want you to do, I want you to grab a sheet of paper. And on the top of your paper, I want you to write 3 words: past, present, and future. I'll give you a minute just to do that. So we're going to spend just a minute or two simply noticing our thoughts. And during this practice, I want you to put a check mark under the category of whatever thought came into your mind. So for example, if you had the thought, I can't believe that happened yesterday, then you could put a check mark under past. If you had a thought, it's really warm here, that is a present thought, and you can put a check mark under the present category. And of course, if you have a thought, what am I going to have for supper? What am I doing later on today? That would, of course, be a future thought. And so you can put a check mark under the future category. So we're going to spend 1 to 2 minutes and simply want you to bring yourself present, notice the thoughts that are running through your head, and then just put them under the appropriate category. And of course, after, we will have just a brief reflection. And this is just to give you a sense of a mindfulness practice that we would do in our group and within our comprehensive DBT program. So I will start the clock, and I will let you know when we finish. Okay, we can stop just in the interest of time. So we always have a reflection after our mindfulness practice. And so you guys can use the group chat, and I'm just going to throw out some questions, which would be typical questions we would use in our reflection part of our mindfulness practice. And you can just use the group chat there to answer the questions. So as we were doing this practice, what did you notice? Did it bring more awareness to your thoughts? Did you find you were able to be focused on the practice and simply notice the thoughts that were running through your head? Did anyone notice any distractions, any sounds that they heard and their thoughts were pulled away to? Did anyone notice any judgments that may have arisen, such as, I don't like this exercise, or I'm not very good at this? Those are things we would categorize as judgments. So what was your experience during that very brief practice? Okay, so we see that more thoughts were more present than anything else. Notice more awareness for thoughts in the present, a little easier to keep your mind in the present. It's trying not to let it be there. Okay, so some people, Kathy noticed some outside noises that were pulling her away, some distractions. Some others noticed a lot of future thoughts there. Yeah, excellent. And I think this is a typical practice that we would do. And again, it just allows us to be more aware of our thoughts. And I think we do certainly have a tendency to be more in the future. And I think this really can highlight that for people. We're pulled away with distractions and judgments, and of course, spend a lot of time in the future. And so this can really develop some buy-in for mindfulness in terms of the value and the benefit we can get from bringing ourselves more present there. So thank you, guys. So that clues up my section there, and I'm going to pass it over to Gina.
Thanks, Aldina. So I'm going to provide an overview of the other three skills and modules three modules that we would teach in DBT. So the first is distress tolerance. Each of the four modules that we teach contain a number of skills that are specific to each topic. You'll notice the use of acronyms throughout our DBT modules. Acronyms are used quite frequently, I guess, to help improve learning as well as retention of material. The purpose of distress tolerance skills is not to make a person's distress go away. Rather, this is to improve the ability to manage or tolerate stress without making things worse. Distress tolerance skills are designed to help with tolerating difficult situations and tolerating emotional pain when situations cannot be immediately resolved. Some points to consider when thinking of distress tolerance are each of us essentially will encounter emotional pain in our life, as this is a natural part of the human experience. It's also important to recognize that trying to avoid pain may cause more problems than it actually solves. This may lead one to act more impulsively, where they may end up hurting themselves or others, and ultimately not having their needs met. Everyone can benefit from having skills to help cope with distress. You do not need to experience severe, prolonged, or emotion dysregulation to benefit from learning distress tolerance skills. There are two categories in distress tolerance that we teach: crisis survival strategies, as well as reality acceptance skills. Crisis survival skills include distracting, self-soothing, improving the moment, pros and cons, and the tip skill. These skills help decrease impulsivity, improve the ability to manage pain skillfully, and prevent you from engaging in problem behaviors. It's important to remember that distress tolerance skills can also be overused. This can create avoidance behavior, particularly when we're not using the other skills as well. It's also important to remember to use crisis survival skills. It is essential that we are aware that we're feeling stressed. So just as Aldina had covered, we reviewed the practice of mindfulness and using wise mind. This practice will increase awareness and provide a pause where it allows the individual to engage distress tolerance skills instead of using old coping strategies or old behaviors. These behaviors can include suicidal ideation, anger behaviors, disordered eating, reckless driving, lying, stealing, addictions, and a multitude of others. Reality acceptance skills are skills used to increase the ability to accept painful circumstances that cannot be changed. They help reduce avoidance and conflict behavior, which otherwise can lead to long-term suffering. The reality acceptance skills that we teach include radical acceptance, turning the mind, and willingness versus willfulness. The following video will illustrate the T part of the tip skill, the tipping the temperature by activating the body's dive reflex with cold water. During this time, there is an increased activity of the parasympathetic nervous system. This provides a reset, essentially, to the nervous system, which is hyper-aroused at that time.
The most useful skills that we've learned so far in DBT, or that I've studied all of DBT, is the tip skills. So TIP stands for tip the temperature, intense exercise, paced breathing, and paired muscle relaxation. These are skills that you would use in a crisis situation or when you are in a heightened emotional state and would like to snap out of it really quickly. Especially the tip the temperature is one that I use quite often. So I usually carry around some of those quick cold packs that you can buy anywhere off Amazon for like $10 a pack. And then you can keep one with you, and whenever you need it, just break it open and it turns cold. So you would either hold your breath, put your face in a bowl of cold, very cold ice water, or put a cold pack on your face for about 30 seconds. They recommend that you keep it above 50 degrees Fahrenheit, I guess, so that you don't cause any damage. But I find for effectiveness that the colder it is, the better. Hold your breath while you're doing this and keep your face below your heart. This is called a dive reflex. So it tricks your brain into thinking that you are diving into cold water, which shocks you out of your emotional dysregulation. And then you can usually use other skills once you're thinking clearly. So I'm going to demonstrate this. For this, you need very cold water. I usually keep Brita water for drinking in our refrigerator. That works a lot better than keeping a bowl of water in the refrigerator, for me at least. I don't really have the space in my fridge for a giant bowl of water. And a lot of people don't have big bowls, so I've had to use sinks lots of times before. As long as they're clean, it's very useful. So lots of cold water, and just to make it extra cold, I'm going to dump in ice. Now this is a skill that you would want to practice when you are not in crisis, so that you can be familiar with it and have it as one of your skills in your back pocket to use when you are in crisis. It's not very pleasant, but it's not supposed to be. My heart rate at the moment is 118. Can I get a count to 30 from you while I'm underwater? If you aren't able to hold your breath for that long, come back up, take a deep breath, stick it right back in. So it's for 30 seconds or as long as you can tolerate until it brings you down. Theoretically, this should bring down my heart rate, and as I'm a little bit nervous right now from doing this video, it should also help to calm me down. Okay, ready?
Ready. Ten seconds. $20 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Good job. Right behind you.
All right.
How do you feel?
I feel calmer almost immediately within probably about the first 10 seconds. And my heart rate is now at 61.
No way!
That's pretty frigging effective.
Wow!
I really strongly recommend using this. I've told a lot of friends about this who think I'm a little ridiculous at first until you try it.
And here we have the evidence, my friends.
It's a biological response that this will immediately calm you down. It's not going to solve the problem, whatever is causing the crisis, but it brings you down enough that you can now think it through rationally and use other skills to help you out.
Well done.
Perfect. So this is a great illustration of the skill that we teach during this particular module. The next module that we will review today is emotion regulation. This module focuses on deepening the understanding of emotions and how emotions can influence behavior. The goals of emotion regulation are to increase understanding of emotions and how they are being experienced, to reduce vulnerability to experiencing the emotional mind for too long, and to decrease long-term emotional suffering. You'd likely not use most of these in the context of a mental health crisis. Rather, they are to support you in having a more balanced emotional state. Emotion regulation skills include opposite action, check the facts, problem solving, EBE please, accumulating positive emotions, building mastery, cope ahead, and taking care of your body and your mind. The emotion regulation model of emotions provides an understanding of how we experience emotion and how this experience influences behavior. The first stage is the prompting event, so something inside or outside of you occurs, such as a thought or an actual event. During the second stage is where interpretation of the event occurs. This is where we make sense of things, essentially our perception of what has occurred. Our perception, of course, is influenced by many things, one of which is our previous experiences. During the third stage is emotional experiencing. At this time, the brain is starting to respond to our interpretation of the event. The brain is activating the stress response and is sending messages throughout the body via the vagus nerve to help prepare for the needed response. During the fourth stage is emotional expressions. This is where the body engages a response based on the emotion it's experiencing. This could include different facial expressions, posture, words, and different actions. In the fifth stage, we call this the after effects. This is where the person will experience different memories, thoughts, physical responses, behavior, and secondary emotions. This can leave a person more vulnerable to entering into an emotional state and experiencing this all over again. So we teach emotion regulation skills to help the individual experience and manage emotions without making things worse throughout any of the 5 stages that are shown in this model. Interpersonal effectiveness is the final module that we'll talk about today. The goals of this module are to create and maintain healthy relationships, to help someone or to help you get what you want, or to get someone to do what you want, as well as to help maintain self-respect. One minute. The module focuses on broadening the understanding of how emotion and behavior influence relationships. It highlights how interpersonal conflict can trigger impulse behavior and what the impact of being in emotion mind for too long can be. This can include escalating conflict, harming relationships, and increasing personal distress. The following video will illustrate the importance of learning interpersonal effectiveness. Some people may have seen this before, but this is a great illustration showing, I guess, how the importance of interpersonal effectiveness can be for all of us.
First, there was PlayStation, aka PS1. Then there's PS2, PS3, and now PS4. And that makes sense. You'd think after Xbox, there'd be Xbox 2. But no. Next came Xbox 360. And now, after 360, comes Xbox One. Why one? Maybe that's how many seconds of thought they put into naming it.
Can you get the butter, please?
Yeah, however, with the Xbox One, I can control my entire entertainment system using voice commands. Up until now, I've had to use Leonard.
Then get the other one. Pass the butter.
Hang on. I don't feel like you're taking this dilemma seriously.
Fine, Sheldon. You have my undivided attention.
Okay, now, the PS4 is more angular and sleek looking.
No way!
It's true, but the larger size of the Xbox One may keep it from overheating.
Well, you wouldn't want your gaming system to overheat?
No, see, well, you absolutely would not. And furthermore, the Xbox One now comes with a Kinect included.
Included?
Yes. Not sold separately. Although the PS4 uses cool new GDDR5 RAM, while the Xbox One is still using the conventional DDR3 memory.
Why would they still be using DDR3? Are they nuts?
See, that's what I thought. But then they go and throw in an ES RAM buffer.
Whoa, wait a second. Who's they?
Xbox.
You're kidding!
No, I am not. And this ES RAM buffer should totally bridge the 100 gigabit per second bandwidth gap between the two RAM types.
This is a nightmare. How will you ever make a decision?
See, I don't know. What should I do?
Please pass the butter!
So this ends my portion, I guess, of the presentation. Just, I guess, to recap, this is a great video that we certainly use in teaching the skills. It really highlights, I guess, the use of different interpersonal strategies that help us achieve what we need and what we want to happen in the moment. I'll hand things over to Dina now for the final section of our presentation.
Thank you, Gina. So the comprehensive DBT program is very specialized and intense program. So you can imagine we have to adhere to the strictly to the referral criteria. So the referral criteria entails people with the stage 1 behaviors. Stage 1 behaviors meaning that people have areas of discontrol in their behavior, like suicide behaviors, suicide planning, rehearsing suicide, suicide letter writing, attempting suicide, or the self-harm, including but not limited to burning, skin picking, cutting, piercing to cause pains, self-hitting, hitting objects, self-harm, etc. And we look at the frequency and the duration of such behaviors, so the total lifetime occurrences and the recent occurrences. So as you can see, frequency, is it 1 to 2 times? Is it, greater than 10? And of course, we look at the record of the frequent, like recency. So if it's ongoing, continuing, is it more than 2 years ago since the last time it happened? So those things we look at in terms of the information on the referral. So other possible stage 1 behaviors. Now, because the referral is screened by the coordinator and the consultation team, we look through the referral and see what would fit the program and readiness, of course, for the program. So these are a list of other possible stage 1 behaviors, such as possible substance abuse associated with self-harm or suicide behaviors, disordered eating behaviors, excessive screen use, problem sexual behaviors, problem gambling, excessive spending, risking driving behaviors such as recklessness, excessive speed, verbal lashing out, physical lashing out at objects or people, illegal behavior such as shoplifting or vandalism, excessive time in bed, lying or dishonesty causing problems for that person, behaviors that cause problems in the past, therapy and counseling. We call that therapy interfering behavior. Problems with getting into relationships too quickly, problems with ending relationships too quickly. So when we look at the referral, these are things that we would discuss and see if that person would fit the program based on how the behaviors are described. So the referral process itself, the referral would be completed by a mental health clinician. So the person would have to be seen already and be known by the clinician. So they would refer from a caseload after being seen, a few times at least. The DBT coordinator would receive the referral and the team and screen it together in consultation team. We would determine if it fits the criteria, then we would send to pre-treatment. Now, while in the pre-treatment section stage, that person is still considered part of the caseload of the referral source. It's only once we pass the pre-treatment stage and are accepted into the program that the person is accepted from that caseload. If we get to the pre-treatment stage and during that phase we realize the person doesn't fit the criteria, then of course it's referred back to doorways to drop in or the clinical caseload. So once accepted though, the person would start the program with a commitment of 24 weeks for group, individual sessions, and brief phone coaching, of course. We have a lot of success stories. Most recently, for me, I just had a graduation, and I remember the person saying, if it wasn't for this program, my marriage would have ended and my life would be very different. It was out of control, and now I feel like I have a purpose for going on. One other individual talked about how 2 years ago she was deep in the throes of an eating disorder and had such anxiety that she was isolated from everyone. She would never go out in public. Today, she manages her eating disorder well. She is able to go to the mall, and she attended a high school reunion that she never would have been able to attend in the past. When asked about what made the difference, she stated DBT and the intensity of the program. She had done DBT at various inpatient treatment centers in the past, but none of those programs were as intense or required as much work as this program, and that made the world a difference to her. Another person talked about having 300 plus days in hospital over a 2.5-year span, to going from that to 0 days in hospital and no contact with mobile crisis response or ER. After 12 months in the DBT program, she's graduating and looking for a job, which is amazing. And here's a quote from another individual. You see, for people like me who had a hard time controlling their emotions, who battled addiction for over 20 years, who never had a sense of belonging, DBT opened the door to a life worth living I never thought existed. I learned skills I never knew and have been applying them in everyday life. I learned how to be mindful, to just observe life around me, to recognize my emotion, to check the facts, to weigh out the pros and cons, and to just stop and realize I no longer have to live in the shadows. I can have a life worth living. From a DBT clinician, sent in a quote, I pulled from their file that I would have something that they would have loved to shared. I received a handout we did for their life worth living goals. Theirs were to have a career, go back to school, to help people be independent, and to pay their own bills. We recognized that they have ticked off all these goals. Of course, we had a ball about it, but it was really nice to look back and to see what we have achieved, all this stuff that we were dreaming about in the beginning. And I'll leave you with a quote from an individual we had access service for years with chronic suicidality, ER visits, hospital admissions, etc. This was his statement. I can finally say I feel contentment for the first time in my life. I feel life is worth living. And that says it all. I got to say, when I talk about the personal experiences and quote people, it's very emotional because working in this program, mental health and addictions, for so long, you see a lot of struggles, and it's amazing to see that some of the people who have struggled the most have achieved contentment or even that sense of control in their life. So it's beautiful. So for our vision for a DBT program, of course, we want to see it expanded. We want further training for new members. We want our current members to get ongoing clinical training. We want to get better at what we do. This is a very intensive program, and we need that support. It would be lovely to have DBT dedicated staff, because right now, as everybody knows, we have multiple hats. Frontline clinicians have various roles. And a community listserv would be nice, so that we can share with each other support, resources, and just that knowledge that would help us grow. And of course, the best of what we can do is to offer clients to have a life worth living. Thank you. That ends our session for today. Now, questions.
Wonderful. Thank you so much for this excellent presentation. And we have had some questions coming in. And given that the last thing that you would have been talking about is around the referral and the forms and those kinds of things. So someone's wondering, what is the specific form and referral process for DBT from within NL Health Services? Someone want to start with that question? Dina?
Okay. Yeah. So we accept referrals to this specialized program from within our program. So it comes from mental health clinicians themselves. So the person will be referred to the mental health service in their area, and then if the clinician and the client agrees that they fit their criteria, they would be referred over.
And someone else is wondering, can someone from a remote area of the province participate remotely online in the DBT program?
100%. Most of our programs are online, right across the province, actually. So definitely, if they have access, a secure access, and they can do Zoom, they can be referred.
Yeah, individual sessions can be virtual, as well as our skills groups are virtual as well. So
I just wanted to throw in there, I think part of the question around the referral process, someone was asking about the specific form.
yeah.
So Dina, you correct me if I'm wrong, But what I would suggest is contacting, if you're a mental health and addictions clinician within Newfoundland Labrador Health Services, you could connect with one of us 5 regional coordinators based on the region that you're in, and we can forward you a copy of the referral form. To date, I don't believe it's on like the intranet or in a specific place. So you could email us and we would send you out the referral form to be completed.
Okay, wonderful. Thank you. So we do have still some questions coming in. And we do have more time. So keep the questions coming in. Someone is wondering, is the DBT program for teens and/or adults? And is it, second part to the question, is it true DBT, including both individual and group therapy? Okay, Leslie?
I can answer that one. So our current comprehensive DBT program is an adult program, right? Tell me what that second part was. I'm sorry, Annette.
Is it true DBT, including both individual and group therapy?
Right. Absolutely. It is true DBT. So we run a 24-week skills group. Well, it's a comprehensive group where we're teaching the skills, and that is paired with individual sessions that occur weekly. However, DBT has been adapted for multiple audiences, one of which is children and adolescents. And I'm going to hold this up. I don't know if you can see it, but there is a completely separate manual for DBT with adolescents than it is for adults. But to answer your question, this is true comprehensive DBT that it holds true to the fidelity of the program.
One thing I will add to that, just in terms of DBT for adults or youth, it is an adult program. We do hope to expand it to youth over time. Of course, there needs to be further training and more staff, because DBT for youth is different than DBT for adults. So we would certainly need more training, but that is part of where we hope to go in the future.
Excellent. Thank you.
And currently there is an adolescent program at the Janeway Family Center, but it's not attached to us. But there
Okay.
is one.
Wonderful. Great information. Someone has a question around the tip process and is wondering, can there be any physical problems that can be created by the tip process of dipping face in ice cold water, i.e. someone with heart problems, should they do this? Alvina?
That's a great question. That's actually one of the things that we always say to participants. If you have heart problems or if you have an eating disorder, we want you to be cleared by your physician before you do try the tip skill, because it's not recommended to do it if you're not cleared by your physician and you have some of those physical issues.
Mm-hmm. Okay, wonderful. Thank you. Someone is wondering around the phone counseling. With regards to phone counseling, are staff available 24/7?
Right now in Newfoundland and Labrador, the program covers during working hours only. So other parts may do different things, but at this particular point in Newfoundland and Labrador, we are during working hours. And then clients can access other services as needed outside of those working hours.
Okay, excellent. Another question, great question. What does retention look like when it comes to, people engaging for the full 24 weeks? Anyone want to take that one?
I can just speak to us here in Labrador Zone. The majority of ours go the full 24 weeks. It's been very few that have only done the 6 months. So the majority of what we have seen so far, and we've been doing this since 2021, the majority of our participants do complete the full full 12 months, sorry.
Yeah. And same with us here in Eastern Rural. We definitely have a very high continuation and graduation record.
And I would echo that here on the West Coast as well, that we have little dropout.
Okay, excellent. All right, thank you. Excuse me. Someone was just noting that, what can we learn from some of the challenges, I guess, that participants face while in the program? Have there been any learnings around that piece with the great success stories? But what are the challenges, and what are some of the successes that have come out of those challenges and learnings that have come out of those challenges?
Well, for me, I think being as true to the model as we can possibly be, because the structure of DBT is there for a reason, because it works, and when we have to deviate from that, we risk lessening the success. So that's the one thing, and we've had to modify a few things, but just because it's Newfoundland and the resources. However, we always had to balance that out, right? And being very aware. And again, as a team here, 5 of us share our stories with each other. And when one of us missteps and we learn something from it, then we all learn, right? So that's a good thing.
So just to add on to what Dina said, I think one of the challenges initially that we had definitely was the geographical expanse of our province in Newfoundland and Labrador. And I think, certainly during the pandemic, it forced more of the virtual services. So currently on the West Coast, different things in different areas, we do offer a hybrid model. So clients can come in person, but they can also join online. So that's cut down the barriers for clients, that are living in small communities like Burgeo or, other places around the province. So that no longer is a barrier to us.
Anyone else want to respond, have a comment on that? Okay. All right, thank you. Another question that we've had come in is around the graduation. I guess someone's just wondering how that graduation looks like. Is there a celebration, or what is the nature of the graduation? Oh, Kathy?
So graduation is a big deal. We celebrate it. We allow clients, if they want, it's entirely up to themselves. They can say a few words at the end of their, during the graduation ceremony to talk about what their personal journey was. Some of those stories that Dina read actually came from that graduation process. And, we have cupcakes, and we just make a big deal because it really was a big deal. It's a huge learning commitment, and we celebrate it. It's important. It's a really important process. We give out graduation gifts as well, and I don't know if others want to add.
Yeah, so here in Central, and we all do, I guess, something a little bit different or a little bit unique. But when it comes time for the end of DBT, so we recognize, first of all, that some individuals will re-up. So they'll go for another 6 months. And then at the end of the 12 months, they feel confident that they've completed the program and got as much as they can from it. Then we do the graduation piece. So we right now we are all virtual. So we do a final group, and we usually make it fun. We play a Jeopardy game about all sort of DBT skills and different things. And we do provide all of our graduates, where am I? With these DBT flashcards. We just put them on a binder ring, and they have all the different skills just for a really quick access to them. And we provide them with an official certificate of graduation from the DBT program.
Okay, excellent. Thank you. Someone else is just wondering, can DBT be used for the treatment of anxiety?
I think the important thing to remember, a person doesn't have to have, for example, a borderline personality diagnosis to come into the program. The important piece is that they meet the referral criteria. So that's stage 1 behavior. So if it is a diagnosis of anxiety and there is some stage 1 behavior, they could possibly meet the criteria for the program. So we don't go by diagnosis, we go by whether it meets the criteria. So we have lots of people in our DBT program with different diagnoses for sure.
Okay, thank you. I think someone's just looking for a little more clarification around the referral process, because you've already noted it's done internally and there's a form. So if someone wants to refer, is it to the DBT coordinators? Is that who they connect with, each of you, or is there an intake? Oh, Leslie, you go ahead.
So I'm looking at the question here. They're saying I wanted to refer from their organization. So all of our referrals are internal. So if you have an individual that you think would be appropriate for a comprehensive DBT program, then that individual needs to be referred to mental health and addiction services in their area. And then once they're paired with a clinician, then the client and that clinician would discuss their goals and their needs and determine if a referral to the DBT program would be appropriate. So we don't actually accept referrals from outside agencies. It happens internally. And of course, being referred to mental health and addiction services throughout Newfoundland and Labrador is a free service. And you would, well, I guess here in our region, I can't comment on the other regions, you would call a triage line for an appointment, or call the local office for an appointment to get set up with a counselor.
Okay. All right, excellent, thank you. We're getting down on time, but I think we do have time for another question. Someone is wondering that in the absence of formal DBT training, can or how could clinicians incorporate a DBT approach and skills into their practice? And I'm going to throw in a second part to that question. Where can people obtain, that training in DBT? Oh, go ahead, Leslie.
I'm like, I don't know if anybody else wants to answer the question. So you said in the absence of having that formal training, there is an opportunity. Any clinician can provide what we call DBT informed treatment. So that could be something such as, here I am showing off stuff. Here's like the adult book as an example. This could be you familiarizing yourself with the DBT skills, and then in this book it's full of handouts and worksheets that you could use with your clients. So you could photocopy them and use them. And really it's about being able to learn the DBT language and to learn the skills so that you can share them with your client. Okay. In terms of training, that's like, what do they call it? Like the $64 million question. But here at Newfoundland and Labrador Health Services, our clinicians were provided extensive training from an organization called TIC, and they were based out of the United States. I can't give a specific in terms of you could use this program or that program to be trained, but there certainly are lots of programs out there, both Canadian and in the United States, that could provide training for that comprehensive program.
I think we've been doing DBT informed practice in the province for many years in terms of, counselors plugging in DBT skills in their individual sessions and whatnot. So I think it's about, further learning and, accessing resources. There was some training that TIC did that was just purely skills. and again, the focus for training was mostly for comprehensive DBT staff. However, we absolutely acknowledge and recognize that DBT informed practice is needed and beneficial as well, because not everyone will meet the criteria for the comprehensive program. Not everyone needs an intensive program, but certainly a DBT informed practice. So lots of resources out there that can help with that.
Excellent. Thank you so much.
I also think it's important to make a distinction between the comprehensive program and DBT informed, so people do understand that if they do participate in a DBT program that's not comprehensive, that if that's not the be all end all. So if somebody doesn't succeed in their mind, it's not that they can't do the DBT program later. Just to make sure there's a distinction.
And just to add really quickly, the government right now has committed to DBT services. They have approved funding for us moving forward, and all our coordinators now are in permanent or soon to be permanent positions. So there is a commitment, which is really exciting, because honestly, we love seeing what's happening with clients right now when they finish the program. So just wanted to add that.
Yeah.
Hopefully we're not going anywhere.
Excellent. Thank you so much. Final question, and I think I'll send this one to you, Leslie. Since you're showing the books, someone's wanting to know where they might access those resources that you were showing.
Yep. So in the group chat, I just typed in the title of the book. The book that I showed, which was the adult one, it's called DBT Skills Training Handouts and Worksheets by Marsha Linehan. These books, they're available on Amazon. They're available online to order. Here I am looking for another book, but I'm just not quite seeing it. But so that's the adult version, and then someone was asking about the adolescent version, which is called DBT Skills Manual for Adolescents. Sometimes,
this is another. This is what we call the Bible. So this is a very important book for people wanting to learn DBT.
Yes.
Can you read out the name on that, Dina?
So it's the Cognitive Behavioral Treatment of Borderline Personality Disorder by Marsha Linehan.
Yeah. I'll add to that too. Marsha's memoir is also a great resource. Really gives a really in-depth, understanding of how she developed the program or treatment. Yeah.
And one final book I'm going to show that's often paired with the other one, the DBT Skills Training. So this one is a manual that works with the other book in terms of the worksheets and handouts. However, this book gives a lot more detail in terms of teaching skills. So if you're actually teaching those skills in a group or an individual format, this book offers a lot more information, and the intention is that it is paired with the DBT skills training. And both of those are second edition. So, and both are by Marsha Linehan.
All right, wonderful. Well, I think we've gotten through everyone's questions, and we're just about at the end. So I do want to take this opportunity to thank Aldina, Dina, Leslie, Georgina, and Kathy for facilitating this excellent webinar for us today and for sharing their knowledge and expertise on dialectical behavior therapy and information about the DBT program, comprehensive program that's offered through NLCSW. It is truly appreciated, and thank you for giving so freely of your time in preparing for this session and for facilitating the session. A lot of important information was discussed, and we hope this webinar sparked people's interest in learning more and how this program may be helpful to clients you may be working with. Just a note to say that RSWs may claim 1.5 CPE credits for attending this webinar as per the NLCSW CPE policy. Someone asked a question earlier on in the group about the PowerPoint presentation. So the PDF of the presentation is available in the resource section on the webinar platform. And as we begin to sign off, we do ask that you complete the evaluation that will appear on your screen. As always, your feedback and comments are truly appreciated. And on that note, I just want to thank everyone. Again, thank you to our wonderful presenters, and we hope everyone enjoys the rest of their day. Thank you.
Thank you. Bye.
Bye. Thank
Bye.
you.